The top stories tonight in Y News. The national government has allowed medical facilities to shorten the period of isolation and quarantine for fully vaccinated healthcare workers.
The PNP-CIDG has filed a case against another Filipino who allegedly violated quarantine protocols.
Unvaccinated individuals leisurely roaming outdoors may face fines and community service according to the Department of the Interior and local government.
Former Senator and now presidential aspirant Ferdinand Bongbong Marcos Jr. skips the hearing on the 3 disqualification cases filed against him before the Commission on Elections.
Good evening, Philippines and the world. We are now reporting live from Quezon City, and today is Friday, January 7, 2022. Join us in the next hour as we deliver today's top stories around the Philippines and in other parts of the world. I am William Theo.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and social media accounts and our website, untvweb.com. I am Kat Tumaraos.
First in the news, leading airline companies received several requests from passengers to cancel their domestic flight bookings. The airlines, on their part, allow cancellations, providing options from their paid tickets. Asher Kadapan Jr. tells us why.
COVID-19 infections also affected domestic air passengers, while others tried to prevent contracting the disease by avoiding high-risk areas and activities such as traveling. With this, several passengers initiate cancellation of their flight bookings amid the surge of COVID-19 cases. In an official statement, the Philippine Airlines said they have been receiving requests to rebook or cancel flights of passengers who have tested positive for COVID-19 or are in precautionary isolation. AirAsia also confirms receiving flight cancellation requests due to COVID-19 infection.
There have been requests to move their flights or actually place their bookings under credit account. May mga passengers na due to the rising number of COVID infections dito sa Metro Manila in particular have decided or have opted to postpone their travel plans.
Cebu Pacific Airline also encourages passengers to voluntarily cancel their flight bookings if they feel any symptoms of the contagious disease.
We advise everyone to be responsible travelers amidst the situation. If symptoms are felt po, please postpone your trips and instead avail na lang po of Cebu Pacific's flexible options. So either rebook po or travel fund.
Meanwhile, PAL and AirAsia confirmed that their operations have not been affected despite having some of their employees not being able to report for work. Cebu Pacific, on the other hand, initiated cancellation of some domestic flights due to COVID-19 infection among their personnel. These include flights originating from or bound for Manila to or from Caticlan for those traveling in Boracay, Cebu, Puerto Princesa, Cagayan de Oro, Davao, Kawayan, and Tacloban.
We are doing all we can to avoid the last-minute cancellations as much as possible. Right now, until January 10 pa lang din siya, pero hindi talaga natin masasabi kung magkakaroon pa ng mga pagbabago in the coming days, no? So we advise that our passengers to keep just be on standby also for our announcements.
The airline has been reaching out to affected passengers to transfer them to another flight scheduled on the same day. All affected passengers, however, have the options to rebook their flights without any fee, credit a cost of the ticket as a travel fund for future air travel activities, or refund the amount. The airlines advised passengers to regularly check the status of their flight as well as the travel requirements by the local government unit of their destination. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
The national government has allowed medical facilities to shorten the period of isolation and quarantine of fully vaccinated healthcare workers. Meanwhile, there will be a new metric for the COVID-19 alert system. Aiko Miguel explains why.
Acting Presidential Spokesman and Cabinet Secretary Carlo Nograles explained the new policy authorizing hospitals. This is to ensure that there will still be enough manpower in medical facilities amid the resurgence of COVID-19 cases brought by Omicron variant of concern. This protocol is only applicable for fully vaccinated healthcare workers.
In extreme circumstances, and upon weighing the risks and benefits, hospital infection prevention and control committees are also authorized to implement shortened isolation protocols for their COVID-19 confirmed fully vaccinated healthcare workers.
Health spokesperson Undersecretary Maria Rosario Vergeres says from 10 days, fully vaccinated healthcare workers who are COVID-19 positive, asymptomatic, or with mild and moderate infection can have their isolation shortened to 5 days, and quarantine can be completely waived for close contacts from the usual 7 days for fully vaccinated healthcare workers.
Makikitang mas maikli ito kaysa sa protocol sa general public, kaya't kailangan pag-aralan at suriin po ito ng mabuti ng mga infection prevention and control committees ng ating ospital, depende sa pangangailangan ng ating mga ospital and weighing the risks and benefits.
Cabinet Secretary Nograles also said that they will include the availability of healthcare workers as a new metric for determining alert levels in areas. Currently, the government uses metrics like healthcare utilization rate, 2-week growth rate of cases, and average daily attack rate on deciding the alert level in an area.
Kung saan ang datos ukol sa healthcare workers ay isasama bilang indicator for alert level classifications.
Meanwhile, the Department of Health will issue guidelines on January 17 regarding the proper use and list of Food and Drug Administration approved antigen home testing.
The illustration below shows how to use self-test kits. Kitang-kita po na mas madali itong gamitin dahil hindi kinakailangang malalim ang maging pagtusok sa ating mga ilong. At present, no antigen test kit that are self-administered has been registered by the Food and Drug Administration yet.
The DOH warns the public there's a proper way to use home testing kits and those sold online are considered fake. Inappropriate use of antigen home test kits may result to false COVID-19 results.
Ito ay pwedeng magbigay ng false sense of security. Maari pong lumabas na negatibo kayo, ngunit ang totoo, positibo po pala kayo, ay nakalabas na kayo at nakapanghawa ng ibang tao.
Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, authorities encourage the public to immediately self-isolate if symptoms of COVID-19. Advices from health experts on the proper way to home isolate. Kath Marao's report.
To address the lack of quarantine and isolation facilities amid the case of COVID-19 continuously increasing in the country, the Interagency Task Force for the Management of Emerging Infectious Diseases has agreed to allow a new home care or self-isolation for patients experiencing mild and asymptomatic symptoms of COVID-19.
We hope dahil to be able to encourage more people na pag mild at asymptomatic, pag conducive yung homes for home isolation, mag-isolate na lang po sa bahay at gagamit na lang po ng telemedicine.
But because it's the cold season, many are confused if they are experiencing COVID-19 or flu because of similar symptoms. That is why health experts advise the public to immediately self-isolate when they feel like having flu-like symptoms. Epidemiologist and infectious disease expert Dr. Eric Tayag advised individuals to try to trace back where and who they were with during the past 3 to 7 days.
Para malaman po kung may COVID o hindi, una, kung meron po kayong exposure sa isang kumpirmadong kaso, ay malamang sa hindi yung nararamdaman nyo po ay COVID. Ngayon, kailan kayo magpapatest? So, ang nire-recommenda po, 3 hanggang 7 araw matapos kayong ma-expose. O kaya, kung meron na kayong sintomas, agad-agad kayo pong magpapatest.
Tayag recommends strengthening the body through adequate sleep, drinking lots of water and vitamins, and eating fruits and vegetables while on self-isolation. It is better for other householders to wear face masks all the time and regularly disinfect. They can also call the DOH hotline number 1555 for a free consultation and get some advices on what to do and what medicines to intake. Barangay Health and Response Team should also be informed about the condition of affected residents.
Lumabas na yung resulta ng test po ninyo. Kung negative, itutuloy nyo pa rin yung quarantine kung isa kayo sa nahawa, or kung yung po ay negative, subalit may sintomas po kayo, ay hintayin nyo po yung abiso nung sa barangay kung kailangan pa kayo mag-isolate sapagkat yung test nyo naman ay negative. Kung positive po yun, mananatili po kayong naka-isolate.
On the question of when home-isolated patients should be taken to the hospital, Dr. Tayag said to immediately contact the DOH hotline and inform the patient's condition, especially if it's a child, senior citizen, or comorbidity. Continuously monitor the patient's oxygen level with pulse oximeter.
Sa mga bata, kung may lagnat po yan at kinukumbulsyon, kailangan po dalhin sa ospital. Sa matatanda, kung may hirap sa paghinga, ibig sabihin yan, hindi na tuloy-tuloy yung pagsasalita nila. Talagang kinakapos ng hininga, hindi na magandang palatandaan yan. Yung mga maselan po ang katawan, tinamaan, halimbawa yung may diabetes, may sakit sa puso, yung sobra ng katandaan. Malamang sa hindi, baka dapat dalhin po kayo sa ospital kahit umpisa pa lang yan ng ubo. Kuya Daniel, kasi yung pneumonia sa matatanda, iba ang presentation.
According to the IATF, they will release new guidelines for home care isolation for proper care of COVID-19 patients at home. Kat Maraos, UNTV News and Rescue. We serve the people, we give glory to God. The Philippine National Police has found probable cause to file a complaint against the woman who also breached COVID-19 quarantine protocols by staying in her condominium unit instead of a quarantine hotel. Leia Ilagan files this exclusive report.
The PNP Criminal Investigation and Detection Group confirms to UNTV that they have filed a case against the second returning overseas Filipino who violated the mandatory quarantine implemented by the government. CIDG Southern District Field Unit Chief Police Major Michael Jan Villanueva said, based on their investigation, the woman commanded her taxi service to bring her to her condo instead of her quarantine hotel in Makati City.
December 22 hapon, nung dumating po si Ms. Munoz, instead po na hinatid po siya sa SEDA Makati kung saan po siya naka-quarantine, nakiusap daw po to si Ms. Munoz na kung po pwede, dumaan lang daw po muna sa bahay niya dahil may kukunin lang daw po siya saglit. Ito nga po yung 36th Street Grand Central Park BGC sa may Taguig po.
Major Villanueva also said that the ROF is also bragging that she is ready to face the consequences of her action based on the affidavit of the taxi driver.
Sinampahan po namin siya ng kasong RA 1133 po dahil po sa paglabag sa quarantine protocol po na pinatutupad natin. Tapos sinampa po natin po ito sa Makati Prosecutor's Office po. Kahapon lang po ng alauna ho ng hapon.
Last Tuesday, the CIDG filed the same criminal case against the so-called Poblacion girl who likewise skipped her quarantine and instead went to a party in Makati. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
Unvaccinated individuals leisurely roaming outside may face fines and community service, according to the Department of the Interior and Local Government. This after President Duterte commands all barangay officials to restrict unvaccinated individuals from going outside and arrest those who will disobey. JP Nunez has the details in this report.
With the rising number of COVID-19 cases, the government continues its effort to encourage more Filipinos to get their vaccine against COVID-19. However, there are still individuals who have not yet received any vaccine dose. With that, President Rodrigo Duterte mandates barangay officials to make sure unvaccinated individuals in the country stay in their houses. Those who will go outside unvaccinated and refuses to obey barangay officials will be arrested.
I'm now giving orders to the barangay captain to look for those persons who are not vaccinated and just would request them or order them, if you may, to stay put. And if he refuses, he goes out of the house and goes around in the community or maybe wherever magpunta, he can be restrained. And if he refuses, then the barangay captain, being a personal authority, is empowered now to arrest the recalcitrant persons.
The Department of the Interior and local government urges LGUs to immediately pass ordinances that will restrict the mobility of unvaccinated individuals. Penalties will depend on their decisions. Sanctions can be in a form of fines or community services. DILG Undersecretary for Barangay Affairs Martin Dino also stressed that they may also face charges if disobedience will be proven, as barangay officials are persons in authority.
Sila ang magdidikta, sila ang magsasabi kung ano ang penalty na ilalagay nila, kung magkano, kung meron niyang halaga, or halimbawa meron silang tinatawag na penalty clause, no? Tapos kung halimbawa may community service o yung may kulong, kasi siyempre pagka ganyan, buhay na ng tao pinag-uusapan natin dito. So ayan, nasa mga LGU yan.
But President Duterte clarified that they will still be given consideration.
Hindi naman kaagad arestuhin. Pakiusap lang. Hindi ka nagpabakuna, then you put everybody in jeopardy. You go out, you get contaminated, dalhin mo. Ngayon, por pamilya, por bahay ang contamination.
JP Nunez, UNTV, News and Rescue. We serve the people. We give glory to God.
Meanwhile, the Philippines' number of new COVID-19 cases swelled up to 21,819 today, pushing the nationwide case count to 2,910,664. The last time that the Philippines recorded more than 20,000 cases was on September 26, 2021, where 20,755 cases were reported. The cases brought the number of active infections nationwide to 77,369. Of these active cases, 70,321 patients were experiencing mild symptoms, 2,837 were in moderate condition, 1,461 were severe, and 312 were critical, and 2,438 were asymptomatic. The number of survivors went up by 973, bringing the total to 2,781,424. The death count, however, jumped to 51,871, with 129 new fatalities confirmed. Meanwhile, the overall global COVID-19 caseload has topped 300,367,306, while the deaths have surged to 5,470,846, according to the Johns Hopkins University. The United States is still the worst hit country with the world's highest number of cases and deaths at 58,487,697 and 833,988 respectively, according to the CSSE, followed by India and Brazil.
The Department of Health records 21,000 vaccine dose wastage in areas severely hit by Typhoon Odette. However, the health department says the number of vaccine wastage might still increase. Eileen Cerudo will tell us why live. Yes, Eileen?
Yes, Kat, power supply and line of communication is still out in several typhoon-hit areas, making it difficult to record the total number of vaccine wastage.
We have initially about 21,000 doses that have been officially reported as wastage. Yung iba po hindi pa nagsasubmit ng report.
DOH Undersecretary Mirna Cabotaje estimates the department will receive the full data by next week or once power supply returns and the line of communication is repaired. Despite this, provinces resumed their COVID-19 vaccine rollout after it was suspended due to typhoon onslaught. 23 local government units in Mimaropa began their rollout last week, while 75% of the areas in Region 7 resumed vaccinating residents. 100% of areas in Southern Leyte and Iloilo are continuing their vaccination rollout. However, there are still vaccination sites in Surigao del Norte and Dinagat Island that remain closed. Local government units are still reviewing how to store the delivered vaccines.
Naghahanap pa tayo ng anong mga pamamaraan para yung bakuna mailapit sa mga kailangan na bakunahan. Either yung tinatawag nating on-time delivery, just in time, ibig sabihin mag-schedule ng bakuna, tapos idadalhin yung bakuna, ibabakuna kaagad. O maghahanap tayo ng mga malalapit na pag-storage facilities para mas madali silang makakuha ng bakuna during their vaccination day.
Based on the update of the National Vaccines Operations Center, there are 51.6 million fully vaccinated in the country, while 2.8 million received booster dose. According to the Health Department, vaccination rollout in various areas is lagging due to the number of health workers getting sick or infected with COVID-19. And that is the latest update. Back to you, Kat.
Thank you, Eileen Cerudo, for that live report.
Presidential aspirant Ferdinand Bongbong Marcos Jr. was not able to attend the hearing on the 3 disqualification cases filed against him before the Commission on Elections or Comelec. Meanwhile, presidential aspirant Senator Panfilo Lacson has tested positive for the coronavirus. Nel Maribohok reports.
Presidential aspirant Ferdinand Bongbong Marcos apologizes for not attending the Commission on Elections preliminary hearing today on the petitions for his disqualification and to delist his name from the roster of presidentiables for the 2022 elections. Marcos is currently in isolation after being exposed to his Chief of Staff, Attorney Vic Rodriguez, and his Chief Security, who both tested positive for COVID-19. Meanwhile, BBM Sara Duterte called the Interagency Task Force for the Management of Emerging Infectious Diseases to issue guidelines for the expansion of home care for COVID-19 patients with mild cases. They made the call amid reports that the healthcare utilization rate in Metro Manila is nearing moderate risk due to the recent increase in COVID-19 cases. According to Uniteam, this will help to unburden the hospitals, especially amid reports that Omicron may be less severe than Delta. They also called on the public to abide health protocols. Today, Manila Mayor Isko Moreno visited the COVID-19 vaccine storage facility in Santa Ana Hospital. He wants to prove that Manila has enough supply of COVID-19 vaccines.
Dumatag sa amin ng tao, mga taga Manila at taga Manila. So, I want to reassure the people of Manila na maraming bakuna. Now we have about 300,000 plus vaccine doses.
Presidential aspirant Senator Panfilo Lacson has tested positive for COVID-19. In a tweet, Lacson said he has already informed those who recently came into contact with about his COVID-19 positive test result. Lacson has been on self-isolation since early this week after he was exposed to his son who tested positive for the virus. Vice President Leni Robredo announced that they will continue their COVID-19 initiatives amid the recent spike of COVID-19 cases in the country.
Gusto ko lang pong sabihin na gaya ng swab cab para sa testing na sinimulan ulit natin, up and running pa rin yung ating Bayanihan e-konsulta. Kung meron tayong nararamdaman at gustong ilapit sa doktor, pwede tayong mag-message sa Facebook page ng Bayanihan e-konsulta para hindi na natin kailangan pumunta pa ng ospital.
She reiterated her call for more medical and non-medical volunteers for the Bayanihan e-Consulta program of the Office of the Vice President. Senator Manny Pacquiao thanked the esports community for answering his plea for help with a donation of at least 200 metric tons of assorted relief goods for Typhoon Odette hit areas. Pacquiao, who recently entered the esports arena, said that the esports community has launched their own Bayanihan Pilipinas QRI donation drive to provide aid for typhoon-affected families. Nel Maribuhok, UNTV News and Rescue, we serve the people, we give glory to God.
The quarantine and isolation guidelines was updated by the CDC. However, it is not being received well by the American Medical Association. Annie Mancilia will tell us the details live. Yes, Annie, good evening. Go ahead.
Good evening, William. As the new guidelines can further put individuals through unnecessary risks to COVID-19 transmission and exposure, the American Medical Association's President Dr. Gerald Harmon called out the questionable actions of the Center for Disease Control and Prevention, or CDC, on Wednesday. Quarantine periods for those positive for COVID-19 have now been shortened from 10 days to just 5 days. Once they are free of fever over 24 hours or have been asymptomatic, they can then end their isolation period on the 5th day. From there, they will need to wear masks for another 5 days. The same follows for those unvaccinated or those months out of their vaccination and not yet boosted. The use of masks is strictly enforced as modeling data from the UK show that 31% of the population stay infectious after the 5th day of isolation. With a shortened quarantine period, Dr. Harmon is concerned that the transmission will surge if people end their quarantine period, return back to school, or work after 5 days with no negative test. He further commented against the advice of the CDC, stating that a negative test is needed to end an isolation period after a positive test. Currently, availability of tests are very low in majority of areas in the United States, and Dr. Harmon is expressing the need to increase production as the low testing supply should not be the reason to omit testing during isolation. William?
Yes, Annie, what about the current CDC guidelines for those who have been in close contact with a person who has COVID-19?
Actually, William, a close contact does not necessarily need to undergo quarantine according to the new guide by the CDC. However, this is only applicable to those 18 years and older who are fully vaccinated and boosted, those aged from 5 to 17 years and fully vaccinated, or those who have been confirmed positive with a viral test within the last 90 days. Mask wearing is compulsory for 10 days and they will need to get tested on the 5th day from contact. If positive, will need to isolate. William?
Yes, thank you. Annie Mancilia reporting live from Singapore.
In Australia, the spiraling number of COVID-19 cases linked to the Omicron variant has led to the eastern states government to reintroduce their pandemic restrictions. Mavian Dog will give us the details live. Yes, Maeve?
Kath, Australia has now acquired more than 74,000 new COVID cases across its states and territories. The state of New South Wales reported a record high daily case number of new infections today at 38,625. NSW Premier Dominic Perrottet announced that new restrictions on singing and dancing in hospitality venues will apply until January 27. Elective surgeries has been postponed until mid-February, and booster shots will also become mandatory for some frontline health workers. Victoria records 21,728 new cases, prompting the state government to also announce the return of density limits to hospitality venues. Kath, in an attempt to free up testing centers and reduce transmission, both New South Wales and Victoria announced that those who tested positive from the rapid antigen test are now considered as probable cases and will be required to log their result with the health department via an online form. Those who returned positive using the rapid antigen test will no longer be required to undergo PCR tests to confirm their infection. In the state of Queensland, there are 10,953 new cases. State Premier Anastasia Palaszczuk encouraged Queenslanders to get their booster shots and strongly recommends working from home. She also addressed concerns about children returning to school later this month.
So we are looking at a 1 to 2 week delay in relation to the return to school. We will give you more concrete decisions on this over the coming days, but I just want to assure parents that that is definitely not on the agenda to send primary school children unvaccinated to school if we are in the peak of this wave.
Meanwhile, Northern Territory has recorded 412, their highest number of COVID-19 cases to date. And unvaccinated people will be subject to a territory-wide lockdown from today until midday on Monday. Kath?
Yes, May. With some restrictions returning in those states, is there some government support that can be expected by the residents?
Kath, Australia's Prime Minister Scott Morrison is urging Australians to check their federal pandemic leave disaster payments eligibility. The payment, Kath, is worth 750 Australian dollars for each 7-day period that a person has been advised to quarantine or self-isolate. Apart from financial aid, the federal government earlier this week announced that the time frame between the second and third dose to be shortened from 5 to 4 months. A plan to shorten it further to 3 months is also on the table by the end of January. Back to you, Kath.
Thank you, Mavian Dog, reporting live from Australia.
A new bill in France called the COVID-19 Vaccine Pass has been approved by the French Parliament, despite a debatable comment made by President Emmanuel Macron when he said that he wanted to annoy the unvaccinated. Jane Robles tells us why live. Yes, Jane, go ahead.
Good evening, William. Majority of the French legislators has agreed to President Emmanuel Macron's vaccine pass plan due to the surging number of infections in France caused by the Delta and Omicron variant. Under the new bill, a negative COVID-19 test will no longer be sufficient. People over 16 years old and not 12 years old, as initially planned, will be required to prove their vaccination status to access public areas such as restaurants, bars, cultural venues, and inter-regional public transport. Prior to the approval of the vaccine pass, the French president made the inflammatory comment on Tuesday, stating that he wants to annoy the unvaccinated by limiting their access to public social activities. The government policy, though, will only affect relatively few people, as almost 90% of French adults have received 2 doses, according to the president. However, Macron's forced language was seen as politically calculated, tapping into an intensifying public frustration against the unvaccinated. Meanwhile, officials hope the new bill will come into effect by January 15. Back to you, William.
Yes, thank you very much. Jane Robles reporting live.
According to a recent study, an additional booster of an mRNA-based COVID-19 vaccine is required to provide immunity against the Omicron variant. Nerissa Dando details why live. Yes, Nerissa?
Good evening, Kat. Getting a third or booster dose of Pfizer or Moderna vaccines provide a significant increase in protection against the new COVID variant Omicron compared to receiving only 2 shots. This is based on results of a research from scientists at the Dragon Institute of MGH, MIT, and Harvard published in the journal Cell. The scientists constructed a harmless version of Omicron known as a pseudovirus. They then conducted their study on blood samples from 239 people. 70 men and women from the group received a third booster dose of either Pfizer and Moderna vaccine. According to Alejandro Balles, the senior author of the paper and an assistant professor at Harvard Medical School, the results were prominent. A dose of Johnson & Johnson and 2 doses of mRNA-based vaccines induce slow neutralization of Omicron, while 3 doses of Pfizer or Moderna provide powerful cross-neutralization against Omicron. Moreover, the said study also supports the recommendation of the Centers for Disease Control and Prevention or CDC for anyone 16 and older to get COVID-19 booster shots. Kath?
Thank you, Nerissa Danda, reporting live from Japan.
A Ghanaian man who met an accident while at work lost his job and now depends only on his parents. His wish is to have a charcoal business to be able to support his own family again. And this little wish has come through with God's help because MCGI cares. Nina Armilio has the story.
A seconds-long incident changed the life of 55-year-old Mawoko Nadi, who lives in Tema, Ghana, Africa.
Ni wa iya CFN nani kwa iwa fukai bile na kan ni wa chuna ni hani ihe wa he no bia ni ba sespono ichunko ni.
All the money he had saved up gone because of the need to get hospitalized after the life-changing accident, which cost him his job. Now he depends on his parents for survival.
Mi papa fie ni. I papa e sian ni kale wo e sian kumemi. No ni pa ni chumuko ni ke babia. Wa ame wa me fie.
And although he has the will to play his role as the father in his own family, Mawoko has no financial capacity to do so.
Condition ni naska ko ni ka ha me no ni bata bi fio. Because ki e me problem. Ka ska sami.
The accident left constant pain in his waist. Now he relies on his parents for pain reliever. He says it's the only thing he takes when he's in pain, so he doesn't need to go far while working for a living.
Nika hon ke video ba maka kwe mbile ke inga ke papa fe.
Members Church of God International, with God's help and mercy, granted Mawoko's wish for a charcoal selling business. Now he has less worries, and once the business flourishes, he can provide for his family once again. They also received free grocery items which they can sell from the MCGI free store. For it is God who worketh in you, both to will and to do of his good pleasure. Akpenamau. Thanks be unto God for his good works and kindness. Let our lips be filled with thanks every day for his blessings, for his continuous mercy. MCGI, with God's guidance, will continue to bring cheers, smiles, and God's blessings to our fellow man in need, because MCGI cares.
And before we close, we will leave you with a word giving glory to God from the book of Proverbs 24:16. It says, "For a just man falleth 7 times and riseth up again, but the wicked shall fall into mischief." And those are the reasons behind the news, January 7, 2021. Reasons we deliver to you as they unfold. I am Kat Dumaraos.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.
In extreme circumstances, and upon weighing the risks and benefits, hospital infection prevention and control committees are also authorized to implement shortened isolation protocols for their COVID-19 confirmed fully vaccinated healthcare workers.
Sinampahan po namin siya ng kasong RA 1133 po dahil po sa paglabag sa quarantine protocol po na pinatutupad natin. Tapos sinampa po natin po ito sa Makati Prosecutor's Office po. Kahapon lang po ng alauna ho ng hapon.
I'm now giving orders to the barangay captain to look for those persons who are not vaccinated and just would request them or order them, if you may, to stay put. And if he refuses, he goes out of the house and goes around in the community or maybe wherever magpunta, he can be restrained. And if he refuses, then the barangay captain, being a personal authority, is empowered now to arrest the recalcitrant persons.